Good afternoon. Thank you very much for joining us this afternoon. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 501. That represents 5% of the total number of tests and takes the total number of confirmed cases in Scotland to 205,999. 138 of those new cases were in Greater Glasgow and Clyde, 99 in Lanarkshire and 67 in Lothian. The remaining cases were spread across the 8 other mainland health board areas. 654 people are currently in hospital. That is an increase of 26. It is worth noting that from today onwards, the Greater Glasgow and Clyde Health Board is recording its figures for COVID patients so that they include people with a positive test from a UK Lighthouse laboratory. Previously, Glasgow only recorded patients who had been tested by the hospital's own programme. Today's change, therefore, brings Glasgow into line with all other health boards. 59 people are in intensive care, which is a decrease of 2 from the day before. And 1 additional death has been registered in the last 24 hours of a patient who first tested positive over the past 28 days. As you may know, we often report a low number of deaths on Monday because registration offices tend to be closed at the weekend. Since last Friday's briefing, a total of 13 deaths have been registered. That takes the total number of deaths registered under the definition used in our daily figures to 7,422. Once again, I extend my condolences to all of those who have lost a loved one as a consequence of COVID. I can also provide an update on the progress of our vaccination programme. As of 8:30 this morning, the total number of people in Scotland who have received their first dose of the vaccine is 1,774,659. That is an increase of 14,909 since yesterday. In addition, 2,802 people received their second dose yesterday, which brings the total number of second doses to 118,732. I can confirm that 96% of 65 to 69-year-olds have now received a first dose of the vaccine, and so too have 42% of 60 to 64-year-olds, 35% of 55 to 59-year-olds, and 29% of 50 to 54-year-olds. The figures for vaccination that have been reported in recent days reflect the slight dip in supply that the Scottish Government previously indicated would happen around now. That may continue to affect vaccination numbers for the rest of this week. However, we expect that during the second half of March and April, the pace of the vaccination programme will again accelerate significantly. We are therefore on track to offer a first dose of the vaccine by the middle of April to all over 50-year-olds, all unpaid carers, and all adults with particular underlying health conditions. I'm joined today by the Chief Medical Officer, Gregor Smith, who will help me to answer some questions shortly. I will address a number of issues about the return to school for more pupils next week. However, before I can do that, I have to address yesterday's events in Glasgow. All of us recognise that winning the league was a special moment for Rangers Football Club. And before I say more, I want to congratulate the club on their success and thank all those fans who celebrated at home and who followed the rules. But the behaviour of some fans has been an absolute disgrace and has undoubtedly cast a shadow over what should have been a special day for the team. The success that we've had in recent weeks in reducing case numbers is because so many people across Scotland have stuck to extremely tough rules, which are designed to prevent the spread of the virus between different households. To see so many people deliberately flouting these rules with no regard for the safety of others is shameful. Events like yesterday risk spreading the virus, and they show no regard or respect at all for the millions of households across Scotland who have been sticking to the rules, who haven't been able to meet up with friends and families, to fully celebrate birthdays and other milestones, or in some cases, to attend funeral services of their loved ones. The Government and Police Scotland reminded Rangers of the need for the club to advise fans to adhere to the current restrictions in discussions on the 26th of February and the 5th of March. It is a matter of profound regret that that did not happen. the Scottish Government will be making our extreme disappointment at the lack of leadership clear to the team management, and will be speaking to all the authorities about what further assurance they can give to us ahead of future planned games. I also understand that many people have questions as to the preparation for and the nature of the policing that took place yesterday, and why they did not prevent people from gathering. I understand the anger of those living and working in the city centre at what they saw and what took place. Policing of such occasions requires difficult operational judgments to be arrived at by Police Scotland. The Justice Secretary has spoken to the Chief Constable and to Rangers Football Club, and will be doing so again, to understand why the events of yesterday took place as they did, what actions are now being taken to identify those responsible, and what more can be done to try to ensure that we do not see the repeats of these scenes at upcoming events. The main issue that I want to highlight today, however, relates to schools. As you know, children in primary 4 to 7 will return to school full-time next week. In addition, next Monday sees the start of a phased return to school for young people in secondary school years 1 to 6. Guidance on this phased return is being published today. Among other things, it stresses that all staff and secondary school pupils should wear face coverings in classrooms, in communal areas, and when moving about the school. The guidance also highlights the importance of 2-metre physical distancing during the phased return. We currently expect, subject to our progress in suppressing the virus and to further scientific advice, that all secondary school pupils will return to full-time in-person learning after the Easter holidays. I can confirm one further measure that we will adopt to make that full return as safe as possible. We already offer twice-weekly tests for all school staff and all senior phase pupils, that is, pupils in secondary school years 4 to 6. We've seen good levels of uptake so far amongst those people who are eligible for tests. We're also working with partners to extend the offer of testing to staff in premises for preschool learning and childcare. We expect to manage this from later this month. We have focused on offering tests to senior phase pupils because they are more likely to get COVID than younger pupils, although it's worth remembering that they are less likely to have the virus than older adults. However, we've also said that we would keep this policy under review. The advisory subgroup on education and children's issues last week noted that there could be benefits in making tests available to young people in secondary school years 1 to 3. We have now had initial discussions on this issue with young people's representatives, with key local government and trade union partners, and with the UK Department of Health, who provide the tests for our schools testing programme. And I can confirm that when children return for their Easter break, we will provide secondary schools with additional test kits. This will allow schools to offer twice-weekly lateral flow home testing kits for all secondary school pupils, including those in S1 to S3. Guidance will re-emphasise that staff and pupils who test positive must self-isolate. As many of you will know by now, lateral flow tests provide extremely quick results, usually within about half an hour. That makes them extremely useful for regular testing programmes of this kind. However, lateral flow tests are less sensitive than laboratory PCR tests. For that reason, we will continue to ask that everyone who tests positive using a lateral flow device has a confirmatory PCR test to reduce the risk of false positive results. Testing will continue to be voluntary, and no one will be excluded from education if they do not wish to test. However, I would strongly encourage staff and pupils to participate to help reduce risks for the whole school community. We will continue to work with partners to monitor levels of uptake and positivity rates among secondary school pupils. We will then review the scope and effectiveness of the programme towards the end of May. It is also important to stress that testing remains one part of a wider package of mitigation measures. Those measures include the wearing of face coverings, as I mentioned earlier, and good ventilation. It will continue to be vital that those wider mitigation measures are implemented rigorously. And of course, staff or pupils must not ignore these other measures simply because they have received a negative test result. Overall, however, we see twice-weekly testing for pupils as an additional precaution, which will help us to make the return of children and young people to school as safe as possible. The final point I'd like to highlight today is to say something about the schedule of briefings for the rest of this week. Tomorrow, as usual, the First Minister will give a statement to Parliament about the pandemic. This is likely to be around about 2:20. As the First Minister said last week, the data is going in the right direction, and so we are all hopeful that we will be able to ease some of the restrictions on people's social interactions when they take place outdoors. On Wednesday, the First Minister is appearing before the Parliament's COVID Committee at the time that this briefing would normally be held. And on Thursday, as usual, the First Minister will provide a brief update to Parliament before First Minister's questions. The next of these regular Scottish Government briefings, therefore, will be on Friday at 12:15. As you have heard, however, we will be providing regular updates to Parliament in the days before then. All of them can be viewed by the public. Those are the main issues I wanted to highlight today. Before I close, I will end as usual by stressing our current rules and guidelines. The most important rule of all remains a very clear one: stay at home. In any Level 4 area, that of course includes all of mainland Scotland, you must only leave the house for essential purposes. Those essential purposes include caring responsibilities, essential shopping and exercise. You cannot meet up with other households indoors, and if you meet up with someone outdoors, you can only at present meet one other person from one other household. You must work from home if you possibly can, and employers have a legal duty to support people to work from home. And on any occasion, when you do leave the house, please remember facts. Wear face coverings when you're doing essential shopping, avoid anywhere that's busy, clean hands and surfaces, use 2-metre distancing if you're talking to someone from another household, and self-isolate and book a test if you have symptoms. Above all else, though, please stay at home as much as is possible. I know how difficult that is, but it is working. And if we stick with it, we can keep the virus under control while vaccination continues. So please stay at home, protect the National Health Service and save lives. Thank you once again to everyone who's doing exactly that. Now, we'll now move on to questions. As I said, Dr. Gregor Smith, the Chief Medical Officer, is with me today to help in answering questions. And the first question is from Ronnie Charters of STV. Ronnie.
Good afternoon, Deputy First Minister. Just to pick you up on a point you raised in your statement regards the celebrations of the Rangers fans last night. You mentioned that the Scottish Government have been in discussions with Rangers on a couple of occasions at least regarding their COVID messaging. You say there's been a lack of leadership at the club. My question is, what more do you think the club should have done and could have done to discourage fans? And if I could, to the Chief Medical Officer, we've all seen the scenes last night, hardly any masks, no social distancing in and around George Square. How worried are you that this will lead to a spike in cases as well?
Okay, I'll say a little bit about both points, Ronnie, and then I'll pass on to the Chief Medical Officer. On messaging, I think it would have been of essential advantage to all of us. Indeed, I think it would have been the duty of Rangers to say clearly and simply to fans that they should not come out to celebrate, and when they did, they should have gone home. And the silence from Rangers was deafening. And that is a matter of profound regret. So if the club, on a day which I acknowledge is a day of joy for the club, had said to its fans to follow the restrictions that are in place, like every other citizen in the country is doing, and gone home and avoided the crowded scenes that we had outside Ibrox and in George Square, then messaging of that type from the club, I think, could have helped to diffuse the situation and, crucially, to disperse the crowds. But it didn't happen, and that is one of the deep elements of concern that the government has about the conduct of Rangers. Now, on the events and the gatherings, as you say fairly in your question, Ronnie, there were a lot of people there not observing physical distancing and not wearing face coverings. So inevitably, there must be a risk that that degree of open social interaction without any precautions in place leads to a significant risk that COVID could potentially spread as a consequence of those actions. And Gregor Smith will say more about that.
Yeah, thanks for your question, Ronnie. I mean, I have to, on a personal perspective, say it was quite demoralising to see so many people coming together in some of the scenes that we saw yesterday. And I'm quite sure my colleagues across the NHS, who at this stage of the pandemic are pretty exhausted in terms of their own response to it, felt that same way when they saw those scenes of people mixing so freely without distancing, without masks. And I think your question is a good one, because when people come together as close as that, in proximity to that, there is always going to be the risk that we begin to pass on infection between people. Again, we know from the latest ONS studies that roughly 1 in 335 people in Scotland have the COVID infection just now. Some of those will be at the pre-symptomatic phase, and it's reasonable to suspect that in the crowds that we saw over the weekend, with so many people coming together, that there will be some people who are capable of passing on some of that infection just now, particularly in the central belt of Scotland, where we know that those statistics show that there's a slightly greater risk of infection as well. So in answer to your question, I think that there is a very real risk that we will see an uptick in infections as a result of some of the scenes that we saw over the weekend. It's entirely plausible.
Thank you. We'll now move on to David Shanks of BBC. David.
Good afternoon, Deputy First Minister. Just again on the Rangers celebrations, you say you want assurances from clubs about future events. Well, we've got a trophy presentation to come, Scottish Cup final. Will assurances be enough, or do tougher measures need to be in place to stop things like this happening again? And just secondly, if I may, on the testing widening in schools, it's only been in for a short time what we have so far, but what uptake have you seen for senior phase pupils so far? And what would constitute success in the widening that you've been?
Thanks very much, David. On the question about football, obviously we're going to engage once again, as we did before the weekend's events, with clubs about their obligations to support the wider messaging that's in place to enforce what is the law in the country about staying at home and about avoiding crowded places. So we'll engage with the clubs and with the football authorities, and also with Police Scotland, as we do on a routine basis on all of these questions, to ensure that everyone plays their part in trying to avoid situations of this type taking their course. You're correct, there's a number of different landmark events that come up in the football calendar in the next few weeks, and we've got to be satisfied that we don't run the risk of a repeat of what we saw at the weekend. So we'll be engaged in those discussions. If there is a need for further action to be taken, the government will obviously consider that. I'm certainly not going to rule anything out today, but I repeat comments that I've made at this podium in the past, that we have made some special measures to try to ensure football can take its course. And it's a matter of real regret that we're here once again having to discuss examples where the behaviour in and around football has not helped us in our efforts to control the virus. Now, on your question about testing within schools, the uptake of the lateral flow device tests by staff and senior phase pupils has been really very encouraging from the very beginning, and I'm grateful to staff and to pupils in our schools for participating in this activity. We're seeing a very high level of participation within those tests, and we'll continue to support staff to undertake those tests and support pupils to undertake those tests. Obviously, we're moving into a different cohort of S1 to S3 pupils, and we have to make sure that they're properly advised and briefed about how to handle these tests. But it forms an important part of creating the assurance about the measures to control the virus within the school estate, and I'm grateful to everyone who's contributed to making it possible for us to extend the testing to S1 to 3 pupils. I don't know if Chief Medical Officer wants to add to that.
Yeah, this is yet another layer of protection and assurance that we can offer to pupils and staff as they return to schools. And like the Deputy First Minister, I am very encouraged by the uptake that we're seeing amongst staff members, but also that senior phase pupils at this point in time. At this point in time, to this point, we have a very low positive yield from those tests, 0.04%, all of which were adult staff members. But for every infection that we're identifying by this means, we're able to kind of stop those chains of transmission and prevent further infections from taking place. And I'm very encouraged at this point in time that this is having its intended effect.
Thanks. We'll now move on to Peter McMahon of ITV Border. Peter.
Thank you very much, Deputy First Minister. Deputy First Minister, if I could pick up on 2 points. You mentioned that the First Minister said last week that the data is going in the right direction and there's a hope of easing further restrictions outdoors tomorrow. Given that the data is going in the right direction, do you think that could be accelerated? And could I just ask, in your capacity as Education Secretary, I know that obviously in Scotland, the primary schools, early years in primary schools are open before schools south of the border. Now schools south of the border are opening. Do you think that in Scotland the pace is correct, or do you think there's scope for accelerating that pace in terms of the return to school and the benefits that will bring to pupils?
Thanks, Peter. The First Minister will give an update to Parliament tomorrow on the progress of measures to control the pandemic. I think all of the data that we'll look at is moving in the right direction. The number of cases is falling. The positivity rate is low. It's slightly higher today at 5%, but for most of the last couple of weeks it's been between 3 and 4. The vaccination programme obviously is going well and has got comprehensive footing within our community, and the pressure on our hospitals, while still significant, is not as grave as it was earlier on. So there are a lot of grounds for optimism, which is also why yesterday's events or the weekend's events are so frustrating into the bargain. So the First Minister will set out what measures we can take tomorrow, and the First Minister has been clear that we will try to relax lockdown as quickly as we possibly can do, but we have to do it in a sustainable manner. And that means taking the appropriate steps in the appropriate sequence to make sure that we don't run the risk of the virus running away from us again. Which I suppose brings me on to your second point, which is about the pace of the return to full-time schooling. And we have done that and I think with the appropriate pace. I think we've brought back primary school, the P1 to 3 pupils in early learning and childcare, as you say, earlier than the rest of the United Kingdom, because we felt that was a safe thing for us to be able to do because of the low prevalence amongst younger children. We'll obviously take a big step next week with the P4 to 7s returning full time, and then all of the secondary pupils, S1 to 6, having some form of in-school experience before the Easter holidays, with a full-time return after the Easter holidays. We judge that to be a sustainable route to take forward. We think we've got to exercise caution. We've got to monitor what is the effect of particular changes that we make to make sure that there's not a detrimental effect on the spread of the virus. And then obviously, as we look at the data just now, with P1 to 3 and early learning having been back since the 22nd of February, we can see that there doesn't appear to be on the face of it any damaging effect on the reduction of the prevalence of the virus. So we'll continue to monitor all that data to make sure that we get it right. Now, you did say in your question, Peter, the important question of the well-being of young people. And that is why we took the decision to enable all secondary school pupils to have some form of face-to-face in-school experience before the Easter holidays, because we are concerned about the well-being of secondary school pupils who are missing out on so much just now, and we were keen to make sure they had some experience with their friends, with their peers, in a school environment, in contact with their teachers at the earliest and safest opportunity. And it's for those reasons that we took the decisions that we have taken, and which we expect to be put into practice next Monday. Can we now move on to Peter Smith of ITV News? Peter.
Thank you very much, Deputy First Minister. Just on this Rangers question, Rangers actually, just before you started speaking, put a statement. They've uploaded a video showing the manager, Steven Gerrard, probably the most high-profile person in Scottish football, saying that he wanted, on Friday, saying that he wanted fans to stay away, stay safe, and to consider the pandemic. Again, repeating the message on Saturday. Their Rangers are drawing attention to that. They're also saying that they initiated open dialogue in advance of yesterday, proactively engaged with our local MP, the Justice Minister, the Scottish Government, Police Scotland, and the SPFL. I guess here they're saying that everybody knew that this title was imminent for weeks, that crowds have been talking online about large gatherings for weeks. In his message, Steven Gerrard also acknowledges, he says, I'm a football manager and it's up to, I'm putting out this message, but it's up to people who are the relevant authorities to deal with this situation. I can say, Deputy First Minister, when I was standing working last night at George Square, I was watching really heavily intoxicated people in the evening carrying copious amounts of alcohol out of the local shops, going to George Square, walking past police to do that and carrying on, setting fireworks off. I assume the police decided it was safer to stay back as a public order event. But when you get to that point, do you really believe that a tweet from a football club was going to clear the streets more effectively than the police could have done? And if not, what more could have happened in advance of that? A lot of people suggesting that people should have simply been turned away from Ibrox by the police or turned away from George Square before we reached that stage. A question also for the Chief Medical Officer. Would you advocate now for the police who were working over the weekend to be given asymptomatic testing?
Thanks, Peter. I think my response to your question is that I think there should have been, and it would have been welcome, sustained messaging from Rangers throughout the weekend that fans should disperse. And that is what I think the club, it would have been helpful if the club had done that. And that would have given a signal, a very clear signal from the leadership of the club of the importance of fans following that guidance and the guidance that the government has put out for the best part of a year and is particularly acute at this particular time. So that messaging would have helped. There is obviously a whole, thousands of individuals who should have exercised personal responsibility by not being there in the first place. So those individuals should have followed their own sense of personal responsibility about these issues. And for the police have got to make sensitive operational judgments. I've read the police report on the weekend events, which has been made available to us. It charts the judgment that the police had to make about the presence of large numbers of people and what it is appropriate and practical for the police to do in such circumstances. Now, of course, some of the behaviour that took place, whether it's about people being intoxicated in public places, or whether that's about damaging memorial benches of members of our society in George Square, which I think is a grievous insult to the individuals concerned. This is the conduct of individuals. And those individuals, well, the police have made arrests in the course of the weekend and they make these judgments about what's appropriate to do so. But I think fundamentally, there has to be very clear messaging from the club about the need for people to stay home, and I think that was absent at the weekend. Gregor.
Peter, I wouldn't advocate mass asymptomatic testing at this point in time, but we'll continue to work with Police Scotland and engage with them on any risk assessment that they are conducting for their staff over this period of time. At this moment in time, we see that the police officers who were involved over the weekend had worn the kind of face coverings, were taking all the precautions that they could do in those circumstances, but they were placed in a very difficult position by the very presence of such a large group of people acting in the way that they did just now. And we'll continue to engage with Police Scotland over the matters that relate to the weekend.
Okay, well,
what lessons do you think your government's learned after these scenes?
Well, we'll certainly intensify the discussions that we have with clubs and with the football authorities. Now, we did all that before the football match, so there was no lack of dialogue about this. I've recounted the occasions in which that happened. It's obviously not got the type of communication that we would have liked to have seen coming out of Rangers. So we'll have to revisit all of those issues as a consequence, and we'll discuss those questions with clubs, with the football authorities, with Police Scotland and with relevant partners on an ongoing basis, given the fact that there's other footballing milestones that lie ahead. And also, let me remind our viewers about the issues that have also been discussed here. That we all want to get to some other prizes in football. We want to get to the prize of the UEFA matches being able to take place over the summer. And it's important that we take the careful steps that enable us to get to those points. So that's what the dialogue has to be about, to make sure that we can make progress on the suppression of the virus, but then also about giving us the opportunity to experience some of these major moments in football, which we all want to experience. Okay, Jack Foster from Global Radio. Jack.
Good afternoon, Deputy First Minister. If I could just step away from the events of yesterday. The First Minister only appeared at one of last week's daily COVID briefings, and the reason for that absence through most of the week was fairly obvious for anyone following events around the so-called Alex Salmond inquiry. She isn't here again today, and you are potentially facing a vote of no confidence in Parliament over this whole affair as well. It is clearly affecting these briefings. The First Minister's absence won't go unnoticed today. So it's probably not a huge leap to assume that it's impacting on the behind-the-scenes work in fighting the pandemic too. How much crucial time and attention from the Scottish Government has been lost now to the fight against COVID as a result of this very public fight within the SNP? And what will the cost of that be in terms of how effectively this pandemic is being dealt with?
I think just a couple of matters of fact, actually, Jack. Last week, the First Minister did the COVID briefing at Parliament on Tuesday. She then gave the update on Thursday at First Minister's question time, and then she was here on Friday. Now, marvellous though the First Minister is, she can't be in two places at once, and she was in front of a parliamentary committee on Wednesday. This coming week, she'll give an update tomorrow in Parliament. She'll be at the COVID committee, a parliamentary committee, which we all have to attend parliamentary committees when requested to. She'll be there on Wednesday. She'll give the update at First Minister's question time on Thursday, and she'll be here doing the briefing on Friday. So I think, the First Minister's right across all of this. And in terms of progress on the pandemic, in my answer to Peter McMahon a moment ago, I talked about the fact that at every level, the situation is improving. We've got case numbers falling, positivity is much lower than it was and has been lower than even it is today. Hospitals are getting to a less critical situation than they were in, and the vaccination programme is motoring and very successful. So I think in all respects, we are making huge progress on the suppression of COVID and the handling of this situation, despite the many other issues that government has to wrestle with, not least of which is the return to full-time education for our children, which is our absolute priority. So I think all of that information, it should give confidence that COVID is getting all the attention it requires within government, despite the fact that we have to deal with a range of other issues into the bargain. Can we move on to Lindsay Hanna now of Bauer Radio? Lindsay?
Thanks, Deputy First Minister. Just back to the events over the weekend, what impact will the gatherings at Ibrox and George Square have on the easing of lockdown restrictions? Is there a chance that any speeding up can now be completely put out of the picture? And just secondly, I appreciate it's already been touched upon, but there's obviously a lot of anger to do with the way that the police handled the situation by not breaking it up when it was a clear breach of lockdown restrictions. What's the point in the police having the powers to fine people when only 7 were handed out?
I'll ask the Chief Medical Officer to say a few words about the implications of the events at the weekend, possibly on the prevalence of the virus and the impact on relaxing lockdown. But just let me say that you are familiar with the judgments that the government makes on all of these questions. We have said that we will be driven by the data. If the data goes in the wrong direction because of what went on at the weekend, that will have an effect on our decision making, because we've been absolutely transparent about this, that it will be the data that drives our decisions. So if the data suddenly, because of all that commotion at the weekend, goes in the wrong direction, we'll have difficult decisions to make as a consequence. So there are consequences flow from all of these events. I'll maybe invite Gregor Smith to just add some comments to that, and then I'll come back to the policing question.
Lindsay, it sows a seed of doubt in my mind just now because at this moment in time, it's going to be a further 2 to 3 weeks before we really see the impact of what happened over the weekend translating through in terms of the data that we see. So as we begin to assess what happens next following the last relaxation of the restrictions 2 weeks ago, it will be towards the end of this week that we really get a firm sense as to what the return of these school groups has, how that's impacted fully over the infection rates. And likewise, what we saw at the weekend will be another further 2 to 3 weeks before we can properly assess what impact that has in terms of increasing the rate of infection. But one thing I would bear in mind as I give you this answer is that central belt, the areas in Glasgow and immediately around Glasgow, Lanarkshire, Ayrshire, Forth Valley and some parts of West Lothian as well. These have been areas that for many, many months have shown higher levels of background infection within the communities than other parts of Scotland. And so whenever you see large groups of people coming together like this, there is always the risk that that's going to cause an uptick in infections again. So we'll be watching very closely over the next 2 to 3 weeks to see exactly what impact that has had on the infection rates that we're seeing across that central belt area.
And then to come back to your point, Lindsay, about policing, obviously the police engage in advance of any event of this nature to try to create the circumstances that can avoid events of the weekend happening. So there was dialogue beforehand to try to avoid all of that happening. When people gathered in this fashion, the police have got difficult and sensitive operational judgments to make about what's best to do in certain circumstances where lots of people gather. And there are options available to the police, and these are operational judgments for police officers to make. And it's not for me, as a government minister, to say what those operational judgments should be. But they are difficult, and I think we all acknowledge that. I think what the police have also done, in the course of the weekend, 28 people were arrested, 7 people were issued with fixed penalty notices or will be the subject of a report to the Procurator Fiscal. So the police have clearly taken action in relation to particular individuals, and they've made judgments about the way to handle these particular events. And there will be further dialogue between the Government and Police Scotland about how we can address these issues at any future occasions that take their course. Can we now move to Nicole Cassells of Central FM? Nicole.
Good afternoon, Deputy First Minister. So you touched on it a little bit there about the case numbers, but in regards to the level system, so the whole of Scotland is expected to move into level 3 at the end of April if all does go well. But you've got places like Clackmannanshire just now who have over 150 cases per 100,000 people. So if case numbers in those areas don't drop by the end of next month, could we see some areas being made to stay in level 4 while the rest of the country drops to level 3? And just quickly for the Chief Medical Officer, following the scenes at the weekend, do you still believe that police should not have priority during the vaccine rollout?
Okay, thanks, Nicole. I'll say a little bit about the first question and maybe invite the Chief Medical Officer to add some comments as well. We're seeing, if you look at the case numbers across the country in rates per 100,000, there's really now quite a very broad range between some areas of the country which have very low levels of virus prevalence and some, such as Clackmannanshire or Stirling, which are at the higher end of the spectrum. And there's obviously a number of examples around the approach has been taken there in relation to community testing, for example, that is perhaps identifying more cases, and we're looking very carefully at all of the data that underpins these factors. But we will continue to make judgments based on the prevalence of the virus when we move to the level system. And we've set out in the strategic framework just last week, was that last week or the week before? It all merges into one. The judgments that will apply to what I would consider to be tighter definition of each of the levels. And we'll continue to make judgments accordingly on each of the circumstances that prevail in local authority areas. We are also considering whether or not we should be applying levels across broader areas than local authority areas, because again, in the example that you cite of Clackmannanshire, there's a lot of movement across the boundaries of Clackmannanshire into neighbouring local authority areas. So we'll make those judgments based on the local circumstances that prevail, should we get to the position that we will hopefully reach later on in April, that we can start to apply that level system again.
I think that's the beauty of the levels-based system that we've got, is that it gives you the flexibility to be able to respond to the needs of a particular area at any point in time. So if you look at the history of the pandemic across Scotland just now, what you can see is that different areas of Scotland have had different experiences. There's a kind of central belt region that I've referred to on a couple of occasions today, which has a particularly bad experience of the pandemic and which has been dealt with really kind of quite significantly by the volume of cases that they've had over the last number of months, whereas other areas of Scotland, while still experiencing the pandemic, it's perhaps not just been as acute an experience that they've had at some points in time. So the levels-based approach allows us that flexibility to respond to the needs of that area at that point in time, and we'll take all that into consideration when we're determining which level should be applied to each area. In response to your question about vaccination, it's really important that we understand what vaccination is for at this point in time. When we launch any vaccination programme, it can have two broad aims. It can either be to try to prevent transmission within a population, or it can be trying to protect a population from the severe effects of disease. At this moment in time, the data that we have around about the COVID-19 vaccine shows us that it can protect against hospitalisation and by reducing mortality as well. We have very limited data at this point in time about transmission. That's why the JCVI, which is the independent body that advises the 4 UK nations on how to approach vaccination campaigns, has given its very specific advice that as we approach vaccination for COVID-19 with the vaccines that we have, it should be to protect those who are most vulnerable. And therefore, I still firmly believe that the approach which has been adopted to make sure that those who are most at risk of dying from COVID-19 are the ones that are prioritised first.
Okay, thanks very much, Gregor. We'll now move on to Katrine Bussey of PA. Katrine.
Hello, Deputy First Minister. I just wondered a couple of things I wanted to ask you about today, if I may. Firstly, about vaccines. You mentioned in your opening remarks that it was hoped that vaccinations would pick up again towards the end of March and into April. Does this mean the Scottish Government will finally hit the target of 400,000 vaccinations in a week? And if so, when would you expect to be able to do that? But also, I wanted to ask about the return of most children to schools. Do we know as yet what impact the return of P1s to P3s has had on the R number? And if we don't know that, how can parents be certain that sending their children back to school next Monday is a safe thing to do? Thank you.
Thanks, Katrine. On the vaccine programme, we saw several weeks ago the programme really operating at its maximum strength when vaccine supply was strong and when the network of vaccination centres was fully up and running and able to perform. And I think if my memory serves me right, we probably delivered 400,000 in 1 week, or very close to it, certainly in the high 300,000s. I don't have the number at the front of my head, but it must have been pretty close to that, because we were essentially vaccinating around about 60,000 people on a daily basis. So I think we will be in that strong position, providing the supply is strong. And I think what I would reassure members of the public about now, and I think this is pretty clear from the evidence, is that we have a vaccination infrastructure in place that can deliver at these levels. Some days, earlier on in February, we were vaccinating 1% of the Scottish population in a day, which is a really superb achievement. But it all depends on vaccination supply. And vaccine supply has been more limited in the course of the last few weeks. We expect that to improve by the start of next week. So I think we'll see further progress in relation to the vaccination programme. But I reiterate the point I made, that all over 50s and those with underlying health conditions will be vaccinated by the middle of April, as we promised. In relation to the return of schools, we obviously are looking at the impact of the return of schools on the data. We had an updated R number last Thursday, which had R within the range of 0.7 to 0.9, and that's been pretty consistent for about 3 to perhaps even 4 weeks. So there doesn't seem to be an immediate effect in that respect. We're obviously seeing continuing falls in the number of cases, despite the fact that early learning and childcare and P1 to 3 have been back. So I think on that data, we can be confident that that move has not resulted in any negative impact on virus prevalence, but we'll continue to review those numbers on an ongoing basis. And we have indicated that there will be a further return to school on Monday the 15th, unless there is some data that emerges that causes us to have pause for thought. But at this stage, it doesn't appear that that is the case. I don't know if you want to add anything.
Yeah, the value of R has been fairly consistent for the last 4 weeks now in Scotland. It's 0.7 to 0.9, so we're not seeing any variation in that at this stage. We'll get the data towards the end of this week, which will be the first measurement of R, which really takes into account the return of schools 2 weeks ago, and we'll be able to see whether there's been any influence on the R number by that return at that point in time. However, what I would say is that we've been monitoring this closely through the National IMT and the public health networks in Scotland, just looking to see whether there's been any evidence of significant widespread transmission within the school estate at this point in time. Though there's been 1 or 2 small outbreaks across Scotland, we're really not seeing anything of any kind of significance at this stage. We'll continue to monitor that, of course, but at this moment in time, as I say, the data is fairly encouraging.
Okay, move to Georgina Hayes of the Daily Telegraph. Georgina.
Good afternoon, both. Sorry about my camera, the seems to have stopped working. Are you concerned that the scenes people saw yesterday from Rangers fans will undermine policing efforts for the wider public during the rest of lockdown and as we continue to ease restrictions? Some people might be wondering why they could get fined for meeting friends and family members when hundreds of football fans were able to gather in George Square against the rules with seemingly very little police intervention. So do you think that's fair? Thank you.
I think what's not fair, Georgina, is the fact that millions of Scottish citizens have made massive sacrifices for the whole year, and they've had to give up on really precious moments in their lives with members of their families, and in some cases, the last moments of their lives. And then they had to watch that last night and over the weekend. And I think that's what's unfair. I think it's just absolutely atrocious that that's what they had to see. So all I can hope is that what I say from this podium gives encouragement to members of the public who are angry about watching those scenes, that the government is with them in sharing that anger, and that we appeal to the many, many millions of Scots in this country who have followed the rules, have made the sacrifices, and have got us to the better position that we're in today, just to stick with it and to not in any way be knocked off course by the events of the weekend. Can we move on to Christine Lavelle of The Sun, please? Christine?
Thank you. Last week, the First Minister said you expect all secondary pupils to receive some in-school education each week from Monday until they fully return after Easter. However, we've heard from some parents that some councils are planning as little as 2 reconnect sessions for pupils, rather than the sort of part-time face-to-face teaching that was outlined. Are you satisfied with this, or do you think that councils should be working to a sort of national minimum for in-school education for secondary pupils in the coming weeks?
What we announced was essentially a mixture of the continuation of remote learning, which has worked really well since January, and some face-to-face in-school experiences for all S1 to S3 pupils. Now that has to be undertaken within the constraints of physical distancing, so therefore that limits the number of pupils that can be on the school estate at any one time. And that will vary across the school estate. Some schools are very high levels of occupancy, other schools are lower levels of occupancy. So it will vary from school to school. So that's why we have to give local flexibility to enable that to be put in place. One of the points that's been uppermost in our thinking has been to give all young people in our secondary schools an opportunity to reconnect with their peers and with their school environment and with their teachers. That will vary across the country, but it's complemented by the availability of remote learning, which has been a strong proposition. So I think we should trust our education professionals to be able to design what is appropriate and safe at local level for all young people. And I think that will help to provide some sense to young people that we are moving on from the very severe restrictions that they have had to endure more than others within society, and to give them a taste back of face-to-face schooling, which is an important commitment. Can we move on to Tom Martin of the Daily Express, please? Tom.
Hi, good afternoon. Thank you, Deputy First Minister. Again, just returning to the scenes at the weekend, and you've obviously expressed some concerns around the lack of sustained messaging and the club's response to the situation. Do you believe Rangers itself should face sanctions, whether that's some form of penalty from the footballing authorities, or indeed some kind of police action as a result of what we saw?
Obviously, issues for the football authorities are for the football authorities, and issues for the police are for the police. I can't dictate to either of them, and nor should I. It's thoroughly inappropriate for me to do that. I can express the concerns that we have here. The government obviously will reflect on the events of the weekend. We've got, as I've said a number of times today, a number of football milestones coming up in forthcoming weeks. We've got to take enormous care to make sure that we don't have a repeat of the weekend for all the reasons that I've rehearsed already, and we will be endeavouring to make sure that we enlist the support of clubs, the football authorities and all other relevant parties to make sure that's the case. Can I move on to Elsa Maishman of the Scotsman? Elsa?
Thanks, Deputy First Minister. Can I first just ask for a bit of clarification on something you said at the beginning about the reporting of COVID tests in Greater Glasgow and Clyde? Does that relate to tests reported by the Health Board or the kind of collection of data by Public Health Scotland? And does it mean that numbers for previous outbreaks would actually have been higher than they would have been reported? Or I wonder if you could just give a bit more detail on what that means in practice. And secondly, just returning to the vaccination programme, you said in answer to a couple of questions ago that it was at its maximum strength a few weeks ago. It didn't actually ever hit 400,000. It was, like you said, the high 390,000 is a little bit under that. But does that mean what you said, that 400,000 a week, while that's kind of a target that the Scottish Government has been aiming for, is that the maximum that we could ever get to in terms of vaccinators and other infrastructure in place, regardless of how high supplies went in a certain week?
Okay, I'll ask, thanks Elsa, I'll ask the Chief Medical Officer to come back to you on the numbers in Greater Glasgow and Clyde. I think on the vaccination programme, I think, if my memory serves me right, I think it was high 300s, thousands that we reached. But, my point is we're there or thereabouts, and we're delivering, a formidable vaccination programme. Could it be expanded? Yes, of course it could be expanded, and but crucially, supply is the issue that we have to be mindful of. And we've demonstrated, because of the performance a number of weeks ago, that we've got the infrastructure in place to utilise supply when it's available. And the priority for us to make sure we've got that sustained, regular supply that enables us to operate at the highest levels of performance of the programme, which we've demonstrated already we're able to do. Gregor, do you want to add to that?
Elsa,
First Minister, sorry, excuse me. Can I just ask, does that mean that there isn't an aim to go higher than the 400,000 if the supply was there?
Well, I suppose it's a bit, it's a wee bit chicken and egg, Elsa, that we've got an outline of what supply is expected to come to us, so we've got a sense of what that will be like, and therefore our infrastructure will be constructed to ensure that we can use that efficiently and effectively in a sustained fashion. But if there was an opportunity for us to be able to accelerate vaccination, then believe you me, the government would want to do that. You know, we've no interest in anything other than vaccinating as quickly and as early as we possibly can do, but we have to have the supply to enable us to do that. Yeah.
So when Glasgow have reported their information on a daily basis, up to this point, it's been on those patients who have tested positive within the NHS laboratory system. As you know, there's 2 laboratory systems who are currently undertaking tests. The Lighthouse labs, which take it, the kind of national approach, it's the ones that you would attend in a local area, and those would be subsequently analysed generally by our Lighthouse lab in Glasgow. But each of the NHS boards also have testing streams within their areas as well. Now, when Glasgow have been reporting results up to this point in time, they've been reporting results are people who've been admitted only on the basis of those who've had confirmatory tests with once they've been in hospital or at the point of admission. So what this does is it expands their definition a little bit to capture those who have been previously been reported as being positive through that Lighthouse system as well, but might not have been tested within the hospital again.
Okay, we'll now move on to Adele Merson of the Press and Journal. Adele.
Thank you, Deputy First Minister. There is some growing anxiety among those in the 60 to 64 age group, many of whom have not been invited for vaccination yet. I was just interested in finding out if a target date has been set for this specific age category, other than the more general target of all over 50s being vaccinated by mid-April, and when can people in this age category expect to receive their letters?
Certainly from my perspective, Adele, I don't think there is a specific target for the over 60s other than the middle of April, and the issue we've had has been about supply of the vaccine, which has slowed up in the last couple of weeks, but we're very confident with the projections of supply that that will be able to be completed by the middle of April. But Gregor, you might want to say some more on that.
Adele, this group is part of a kind of broader group that we've taken at the same time to make sure that we maximise the opportunities for vaccination with some of the Group 6 at-risk cohort as well. And it's come at a time when there have been some issues with constraints around about vaccine supply, but we are expecting that, those supply issues will correct themselves in the very, very near future, and that we'll soon be able to rapidly escalate the number of vaccinations that we're doing each day, and that those people who've been very patiently waiting up to this point will be called forward for those vaccines very soon.
We're sitting, Adele, just now at 42% vaccination levels in the 60 to 64-year-old category, and the next category down in age from that, 55 to 59, we're sitting at 35. So, you know, we're not far away from half of the 60 to 64-year-olds being vaccinated already. But, you know, when you look at the age group above that, 65 to 69, there's a 96% vaccination level. So I understand the unease and the anxiety from members of the public in that age category. I would just ask them to be patient for a little bit longer, and we are confident we'll be able to complete that task in that age group within the timescale that we've set. Could we move on now to David Ball of the Herald? David?
Thank you, Deputy First Minister. The Scottish Government's been pretty clear that when areas go back into the level system, the criteria to move down the levels will be in line with the WHO guidance in terms of cases per 100,000. Taking account of the new variant that's more transmissible. Is it possible, or have your advisors told you that hospitality businesses, when they're able to reopen, could their exemption to the 2 metre rule need to be withdrawn in light of this new transmissible variant? Or are you confident that if the prevalence is low enough that the 1 metre rule will mean that the premises are safe?
We're not quite at that stage yet, David, in our consideration. Obviously, we'll be receiving on an ongoing basis the scientific advice that we receive from our advisory groups on these questions. We're getting some of that on education. We get it on a wider set of issues such as the hospitality sector that you refer to. And of course, my colleagues are engaged actively with the hospitality sector in understanding the issues and the perspectives that they have. So it's a question which is important, David, but slightly premature in the process that we're engaged in, but we will engage constructively with the hospitality sector on trying to advance some of these questions. Michael Blatley of the Daily Mail. Michael.
Hello, good afternoon. Some package holiday companies are currently advertising flights from Scottish airports starting on May 17th, which is in line with the UK government's route map. Do you think it's right that they are advertising and selling these flights right now? Do you think there's any prospect of the ban on non-essential overseas travel being lifted by then? And also in relation to quarantine hotels, do you currently anticipate that even come the summer, people should expect that they will need to go into quarantine hotels for 10 days when they return from any foreign travel?
Thanks, Michael. I think on your first point about package holidays being advertised from the middle of May, I don't think that's a good idea, Michael. I don't think I can give you a more sophisticated answer than that. I think we're far too early in this process, and if we are interested in taking the sustained measures to try to suppress the pandemic, package holidays don't strike me as being the thing that's going to help us in that endeavour. And then on the question of quarantine hotels, you're asking me to get myself away ahead until the summer, but I think, which I can't absolutely predict, but I think quarantine hotels are going to be with us for quite some time to give us the ability to protect the progress that we are making in Scotland to suppress the virus, because there will be other countries around the world which may not be as successful as we are, and we want to protect ourselves against importation of the virus. So I think whether it's a package holiday, I would counsel against it, and quarantine hotels I think are going to be around for quite some time to come. Torkel Crichton of the Daily Record. Torkel.
Good afternoon, Deputy First Minister. Two questions from me based on the front page of the Daily Record today. You'll have seen an SNP staff member has made a complaint of sexual harassment against two SNP MPs. Are you satisfied these claims are being dealt with by the party? And secondly, on Rangers, also on the front page of every newspaper today, notwithstanding what you've said, your patience is running out with the club. You say the UEFA matches are threatened. What's your direct message now to Rangers fans, many of whom will not have been involved in last night's incidents? What's your message to Rangers fans ahead of other games?
On your first point, Torkel, this is a COVID briefing, but I will, of course, give you the courtesy of a reply, which is I'm certain all these issues that you've reported will be being pursued properly and appropriately by the SNP and all those involved. On the Rangers question, I feel really sorry for all the Rangers fans who stayed at home and who celebrated in their own home, in some cases probably on their own, at what was a major moment for the club. And they've had that sort of undermined by what went on outside Ibrox and in George Square yesterday. And these good folk who are entitled to celebrate the success of their club probably feel a bit scunnered this morning about it all. So to all those, so I feel sorry for those individuals because they're entitled to have their moment of celebration. And I saw pictures on social media of Rangers fans individually celebrating at home with their scarves on and their tops on, and there looked as if there was some drink involved as well. But they were in their own homes doing that. What is the problem is the gathering of people and the risk of the spread of the virus in this current context. So my appeal is that all football fans, and particularly those who were involved in that behaviour at the weekend, exercise due caution and follow the restrictions on all future occasions. And if they do that, they will be part of joining the millions of other people in Scotland who are playing by the rules and who are trying to do all they can to suppress the virus. The last question today is from Mark McLaughlin from The Times. Mark.
Afternoon, both. I've got a technical question for the Chief Medical Officer related to this new hospital recategorisation. On the trajectory that the hospital admissions were at, it was on course to be, completely empty by the end of March. People were leaving at a rate of about 30 a day. Is this going to upset that? Is it basically going to kick on the technical number of people that are going to be in hospital because of this new expanded rate? You get a lot of noise online about the government moving the goalposts, so somebody's in with a broken leg, but they're classed as a COVID case because they tested positive 28 days before. How do you distinguish between that to make sure that it's a genuine pandemic monitor and not just soaking in all sorts of cases? And the same with the test positivity. There's been a lot of noise about sentinel testing versus the asymptomatic testing that you're doing and the symptomatic testing at Lighthouse Labs. Are we following the World Health Organization's guidance with both the positivity and the hospital cases? And a political question for you, Deputy First Minister. Is it time to revisit strict liability for football like James Dornan considered in his members' bill a couple of years ago?
I'll ask the Chief Medical Officer to deal with the technical question first.
I don't expect that the data that we're referring to today is going to significantly impact on any of the trajectories that we're currently seeing at all. If we look at the trajectories over the last couple of weeks, with 361 admissions to hospital on the week to the 4th of March compared to 472 the week before, I expect that trajectory will continue. Now, how far down we will be able to get, it will be still a matter of uncertainty. A lot of that will depend exactly what impacts the kind of gradual relaxation of restrictions creates in terms of opportunities for those infections to re-emerge. I think it's unlikely we'll ever get to a 0 point at all, where we have no admissions to hospital in the near future, although that's certainly going to be one of our longer term aims, particularly with the success of the vaccination programme. But in this immediate future just now, I suspect that we will still continue to see at least some COVID cases ending up and requiring admission to hospital for the foreseeable future. And as I say, the minor change that we're seeing in the way that one health board is dealing with their data, I don't think is likely to impact on that at all. In relation to the test positivity, it's something that we're constantly reviewing, and we're looking at how we can disaggregate all the data that's available to us in a way that allows us to make best use of that data, and we'll continue to do that.
Thanks very much, Gregor. The only point I would add to that is that obviously we're looking at a whole range of different data which forms the judgment within the government about the progress that we're making in reducing prevalence of the virus. So there's a whole range of different indicators that we assess. It's not just one, such as hospital admissions or hospital attendance, that would get us to that position. On your other point, Mark, I think the most important issue that we should focus on just now is making sure we don't have a repeat, on the football question, is a repeat of the weekend's events. And that has to be ensuring compliance and adherence to the restrictions that are in place to protect public safety, to protect public health, to make sure that we're all doing our bit to suppress the virus, is where we should concentrate our efforts just now. So with those words, can I draw things to a close today? Can I thank Jill, our BSL interpreter, for her support today? Can I thank you all for observing? Can I thank the journalists for their questions? Can I end by reminding everybody of the importance of facts, of wearing face coverings when you're doing essential shopping, of avoiding anywhere busy, cleaning hands and surfaces, of using 2 metre distancing if you're talking to someone from another household, and self-isolate and book a test if you have symptoms. Can I thank everyone for what they're doing to suppress the virus? If we all redouble our efforts, we can make more progress at an earlier stage. And if we all stay at home, we will protect the National Health Service and will save lives. Thank you very much for tuning in today. And please stay safe and look after each other. Thank you.